Brian, thank you so much for taking the time to visit with me today. I'd love to hear about you and your experience with Fanconi anemia and unfortunately your experience with head and neck cancer.
Absolutely. Thank you for having me on with you guys today. My experience with Fanconi anemia started when I was in seventh grade.
Wow.
I was coming out of football season and coming into tennis season, and my tennis coach actually told my parents, he's a little bit lethargic as compared to normal. Why don't you go have him get a blood test? And this came from a young lady who was about 23 at the time.
Wow.
So lo and behold, we went ahead. We went in and got a blood test and came back. Wow, the counts are a little bit abnormal. And that got the whole ball rolling. And next thing you know, I was going to see Dr. Wall over at Nemours in Orlando. And lucky enough for me, Dr. Wall had seen a couple of Fanconi patients who presented some closer to myself. I'm on the taller side for Fanconi and don't have some of the typical markings, but she did pick up on a smaller circumference head and as well as some additional cafe au lait spots, and that was her. She picked up on it and said, we got to wait till we get a chromosomal breakage study. And that's where kind of everything began. I did go see, with the original diagnosis of aplastic anemia, did go up to the NIH and met Dr. Alter as well as Dr. Young, who specializes in the aplastic anemia.
So you were 12 years old when this happened to you?
Roughly.
Yeah, so what did it feel like?
For me, it was just kind of, okay, we've now got this to deal with. And it was, especially in the beginning, everything moved so fast. We really didn't have much time to think. I'm sure my parents went ahead and had some additional thoughts, but myself as a 12-year-old, I was more concerned about when I could get back to doing normal things.
So when, if ever, did you start feeling sick, Brian?
Never really did feel sick. I guess you could say did have a little bit less energy, one might say, but to me it wasn't substantially noticeable. But I guess to my tennis coach it was.
And then after that diagnosis, when was the first time that you actually had a medical intervention because of your Fanconi anemia?
The medical intervention, besides we went and we met with the three primary FA centers in the U.S. for FA, and of course you had the follow-up bone marrow biopsies that were done periodically. But my first kind of real medical intervention was when I was 15, and we noticed that during one of the bone marrow biopsies, the cell count went up, but along with the cell count that we found, which was it? It was, I can't remember which one they found something in the bone marrow biopsy, and it's escaping me at the moment, but it pretty much said, okay, it's time to go to transplant.
Wow. So you're 15 years old, you don't really feel sick, and now you need a transplant.
Correct. We had actually just finished, I was playing tennis at that time for my high school, and we had actually just finished the state championship. So came right out of that and went directly into transplant mode.
My goodness, what was that experience like for you?
There were a lot of ups and downs. it was for me a long process. It's it was a relatively, the beginning got off to a good start, but then did start seeing some complications, had some mild GVHD, we had some of the usual complications. VRE, ended up getting hemorrhagic cystitis, and that one wasn't too fun, but tried to make it as much of it as we could, and ended up having a GI bleed that put me back into ICU for quite a while. So all in all, there were some challenges, but came out of it on the other side. I think we spent about 9 months in Minnesota before they let me come back to Florida.
Wow. So after you had your transplant and recovered from all of these complications, when did you begin to feel like your normal self again?
That's kind of funny. Everyone at Minnesota kind of said you won't feel like yourself until you get back home. And actually the night we got back home, I was able to go ahead and jumped in the car and actually went to dinner with a couple of friends. So at that point, kind of just hit the ground running and tried to move back to as normal a life as we can possibly get to.
That's wonderful. So now you're in the later stages of high school.
Mm-hmm.
Tell me about the rest of your life until you encountered yet another health problem due to Fanconi.
Well, the rest of high school was uneventful. I did end up graduating, which was very nice. I know my parents were happy with that, and ended up getting into the University of Florida. So pretty much went exactly, and that was a fun time to be there. We had Tim Tebow, who was playing at that time, and actually got to meet him a few times working on some of his foundations. So what a great time to be at the University of Florida.
And Brian, I guess what I'm wondering is, when you went through the transplant, you're now normal, you graduate from high school, you go to college. How did you view your health problems? Specifically, were they all in the rearview mirror, or did you actually think, I'm at risk for other things?
Well, at that time, right or wrong, I would have to say they were kind of in the rearview mirror at that time.
Totally normal.
Was just enjoying college and high school and everything that goes along with it, and probably wouldn't change that for the world.
Of course not. So what happened next?
After that, ended up graduating and moving to Tampa, and ended up started working in the long-term care industry, which I've been in since then. And it was kind of interesting. That's about I would say 2016, maybe 2015. A year or two after college is when really started to get back in and take Fanconi a little bit more serious, which was a good time to do it. Ended up setting up quarterly visits to either the dentist and then an ENT. So we were really I was really starting more to pay attention to the chances of head and neck cancers coming through. And it was kind of nice with Ralph and his team. Ended up coming to one of the nursing homes I was working at, and ended up doing an oral screening. That was the first time that we did it, and everything came back free and clear. So that was
part
nice.
of a study, though. This was really not part of clinical care. That's so interesting. So your first experience in real screening was as part of a research study.
That was the first real screening. Of course, we were going to the ENT semi-annually and getting scoped, as well as the dentist was using a Visi-Light as well every 6 months to keep an eye on it. But Ralph did go ahead, and it was kind of nice. At the same time, I had a resident at that time who was a German lady and spoke German, so she really enjoyed that meeting with them. And then in 2018, Ralph came back, and he had sent an email and said, "Hey, I'm going to be traveling from Tampa to Orlando. Do you mind if I stop by and see you?" Sure. So he ended up coming to the facility I was working at, and then the office ended up doing another picture and did the scrapings. And Ralph ended up, he saw an area that made him a little bit concerned. Of course, took pictures and did additional scrapings and brought the results back with him to Germany. And a little bit later, we got some information from Ralph saying, "Hey, it looks like you might have some cancer starting in that area." And he was nice enough to put together the whole report of pictures and his findings and his translation from German to English, which made it really nice. And that's kind of what got the ball rolling on my journey with the oral cancers as far as Fanconi goes.
So Brian, how old were you when you got this diagnosis?
I was 29.
Wow. And if I understand correctly, even though you were diligent in seeing a dentist, seeing an ear, nose, and throat doctor, your diagnosis was really made by the parent of an FA patient who was dedicated to densely, we call it phenotyping, but densely collecting data and pictures on all Fanconi anemia patients. So let's call this research. So it sounds to me like your diagnosis was made by a research study, not necessarily by the clinicians that you were seeing for screening. Is that correct?
It really was. And the ENT that we were going to see, or I was seeing, was a local guy on the east coast of Florida who it really wasn't his deal with Fanconi. He was interested, always took a look around, but even kind of when we showed him the area that Ralph had concerns, he wasn't really jumping up and down, but he said, "I'll go ahead and biopsy it." And good thing Ralph caught it early and that we did get the biopsy.
Wow.
That got that when the actual biopsy results came back from the ENTs, really when the ball got rolling.
That's really an amazing story. And I think what it points out is that Fanconi anemia is so rare that even a well-trained doctor like your ENT in your neighborhood had really no experience with it. And it's really the experience that people like Ralph had that were critical to bringing your condition to the recognition of the healthcare workers.
That's correct.
Wow. So where did you have your surgery for your oral cancer?
Ended up having my surgery for oral cancer at the University of Minnesota. That's where I did have my transplant. So have always kept in contact with Dr. Wagner and had been up to see him, checkups and everything. But even though he's hematology oncology, bone marrow transplants, lucky for us, he's also kind of taken an interest in, now that we're doing better on getting the younger patients through childhood and into adulthood. And now that we're starting to see some more of the head and neck cancers that Dr. Alter predicted, they've kind of really stepped up, and kind of what we've been doing with them kind of to supplement this care is went ahead and got oral pathology involved. So a clinical oral pathologist who sees patients as well as oral surgery, and the ENT up there, all great folks who have been working with Fanconi and have kind of jumped on board with Dr. Wagner to really start looking in the mouse, start taking pictures, and really come up with a plan of action on how to do it. So even though I do live in Florida, I have been traveling up to Minnesota about every 3 months to visit that team as well.
That's amazing. So tell us about your surgery. What did they do?
They did an oral resection to the affected area, and the first surgery was relatively painful. The recovery was, at least, mainly due to the fact that they had to take quite a bit of tissue around a back molar, and that really was the most painful part, waiting for the tissue to heal back around that molar. And one of the things that we did do, because the area around that molar, even after the surgery, never seemed like it healed exactly right, we did end up pulling a molar to make that area look better, and just so we could get rid of that irritation, which...
Did you have the lymph nodes in your neck sampled? Did they do a lymph node dissection?
They didn't. We did do a CT with contrast to make sure it hadn't gone anywhere in the body, and it was up on the surface, so they were able to get good margins all the way around, and they could see with the CT that there was no invasion.
Got it. So your treatment, if I understand correctly, was a local resection, and the recovery was painful but manageable.
Manageable. I was able to go back to work within 3 or 4 days, so
wow.
It was just a little uncomfortable to deal with.
Right. And this was how many years ago?
It was 2018.
Got it. And now you go back
tail end of 2018.
Got it. So you now return to Minnesota every 3 months for a complete exam.
Yep. And one of the things that we do to supplement in between visits is that through my dentist, I was able to order an intraoral camera. And so I actually go ahead and monthly will take pictures of the area of concern that we've dealt with the cancers with, as well as the rest of the mouth. And I send it to the Minnesota team every month to go ahead and give them an idea of how the area is looking.
I love this. So it's sort of a DIY, be your own surveillance machine. How hard was it for you, Brian, to learn how to use the camera, and how difficult is it to take the pictures and send them to your expert treatment team?
You know, it's quite easy to do. The camera that I'm using is set up to interface with an EMR. So since I don't have an EMR system on my computer for myself, I had to change a little bit of the settings in the computer, and I'm not able to press the button on the camera and make it work. So my wife Rebecca is kind enough to hit the capture button for me. But overall, going ahead and using the camera, setting up pictures, it auto zooms, it auto focuses. So it's a very easy system to work with.
And how much did it cost? Just curious.
Roughly is a little over $100, I think.
Got it.
And
I guess one final question, because I know we're almost out of time. Has anyone ever discussed clinical trials with you? Have you ever been offered the opportunity to participate in a clinical trial because of your high risk of head and neck cancer?
We've talked about it, specifically some of the trials dealing with metformin. I've had from the the transplant process, my kidneys and liver both took a pretty good whack. So that's laid into our kind of thoughts about whether we go ahead with a trial or not. Some of the trials that are there now is if you get a spot, they use metformin and other treatments to try to shrink it or get it to go away. And we have opted to go in there when we've seen something a little bit suspicious and just take it out.
Got it. So it sounds to me like you grew up, you got to a point where you recognized that your next risk was going to be developing a head and neck cancer. And once you did, you now fully own your role in trying to manage it and prevent it. How can we engage all the Fanconi anemia patients like yourself to band together to really do a better job of preventing and treating these oral cancers? What are your ideas about the community and how we can help you?
Part of my idea, and I'm sure there are others in my situation, I for a while was not involved with some of my peers as I probably should have been. But through Facebook was able to connect with some of them, and as we're interacting, and even if you weren't talking, we're following along with their stories, you start to see some head and neck cancers pop up, and you're always kind of hoping and thinking you made it through the transplant, everything's going good for you right now, living in kind of a daydream that it won't happen. But unfortunately, there is a good chance that it will. And the best way that we've found is early detection and constant vigilance. So my recommendation would be to try to reach out, and even if you're not talking as much to them on a day-to-day basis, your peers, at least follow along the stories and keep a close watch on what's going on.
So time for one last question, maybe. I'm here to represent the research community. I'm an ear, nose, and throat doctor, a head and neck cancer researcher. What can we do to help? What is the most important thing? You, the Fanconi anemia population, what do you need from us?
For I would say one of the biggest things is for everybody who is dealing with Fanconi is to try to see the specialist. Because one of the things I'll bring up is after the first bout of oral cancer that I did have, and we were before we switched to just going to Minnesota and seeing that team every 3 months, ended up seeing a team of ENTs down here in Florida at a research hospital. One actually trained Dr. Andre in Minnesota a few years ago, and also seeing oral pathologists at a research school in Florida as well. And even though they are both highly trained and highly respected in their fields, and for the oral pathologist, there's not too many clinical oral pathology physicians out there who see it. Even though we were going to one of a highly renowned school that does it, they didn't see the number of FA patients. So they weren't as clued into the little changes and how easily something can pop up. And that was probably the big realization that we had, is that, look, now that we're dealing with this, we got to go back to pretty much just dealing with Fanconi specialists and people who see it on a day-to-day basis.
Well, thank you, Brian. I really appreciate your time. Thank you for speaking with me.
No problem. Thank you very much.